Hi, friends, welcome to my YouTube channel Nursing Classes, a place where you get nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम एम्स पटना नर्सिंग ऑफिसर एग्जाम 2020 का क्वेश्चन सॉल्व करने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरी YouTube चैनल को सब्सक्राइब नहीं किया है तो सब्सक्राइब करें और बेल आइकॉन को क्लिक करें जिससे मेरे आने वाली वीडियोस का नोटिफिकेशन पहले मिलेगा। अगर वीडियो अच्छी लगी तो एक लाइक कर देना और अपने दोस्तों के साथ शेयर करना। चलो अब शुरू करते हैं। 51. Which of the following electrolytes does insulin help to move into the cells? A. Bicarbonates. B. Chloride. C. Carbonates. D. Potassium. Correct answer D. Potassium. 52. Temperature of 98.7 degree Fahrenheit is approximately equal to dash degree Celsius. A. 38.16 B. 37.56 C. 37.06 D. 36.52 Correct answer 37.06. 53. Difference between systolic and diastolic blood pressure is called A. Pulse range. B. Pulse length. C. Pulse deficit. D. Pulse pressure. Correct answer D. Pulse pressure. 51. Formula to calculate BMI is A. Weight in kilogram divided by square of height in meters. B. Weight in kilogram divided by height in feet. C. Weight in kilogram divided by square of height in feet. D. Weight in kilogram divided by height in meters. Correct answer A. Weight in kilogram divided by square of height in meters. 55. Which of the following equipment is used for the examination of the ear? A. Ophthalmoscope. B. Laryngoscope. C. Otoscope. D. Proctoscope. Correct answer C. Otoscope. 56. The specific gravity of the urine normally ranges approximately from A. 1.8 to 2.0 B. 1.5 to 1.8 C. 0.75 to 1.00 D. 1.01 to 1.025 Correct answer D. 1.01 to 1.025 57. Insertion of a tube inside the stomach through the nose is called nasogastric dash. A. Irrigation. B. Intubation. C. Extubation. D. Urigation. Correct answer B. Intubation. 58. Intravenous solution of 0.45% sodium chloride is a dash solution. A. Colloid. B. Hypertonic. C. Hypertonic. D. Isotonic. Correct answer C. Hypertonic. 59. Dash is the process of introducing a disinfectant solution to the internal environment of the body when someone passes away. A. Bacterium. B. Revaccination. C. Embalming. D. Rinsing. Correct answer C. Embalming. 60. Dash enema is also called antispasmodic enema. A. Cold. B. Carminative. C. Antihelminthic. D. Oil. Correct answer B. Carminative. 61. HbA1c, glycated hemoglobin, value reflects the blood glucose levels in the past dashed months. A. 1, B. 7, C. 3, D. 9. Correct answer C. 3. 62. The sudden fall of temperature from high to normal within a few hours is called A. Hypothermia, B. Lysis, C. True crisis, D. False crisis. Correct answer C. True crisis. 63. In a healthy individual, weighing 70 kilograms at rest, the stroke volume is about A. 150 milliliters, B. 100 milliliters, C. 50 milliliters, D. 70 milliliters. Correct answer D. 70 milliliters. 64. The fever in which temperature remains above normal throughout the day and fluctuate more than 2 degrees Fahrenheit is known as dash fever. A. Isis, B. Remittent, C. Inverted, D. Intermittent. Correct answer B. Remittent. 65. The site of pulse in the neck is called A. Temporal, B. Radial, C. Carotid, D. Popliteal. Correct answer C. Carotid. 66. The gradual decrease in body's temperature after death is called A. Stiff mortis, B. Algor mortis, C. Rigor mortis, D. Liver mortis. Correct answer B. Algor mortis. 67. The discoloration that appears in the dependent areas of the body after death is called A. Rigor mortis, B. Liver mortis, C. Algor mortis, D. Stiff mortis. Correct answer B. Liver mortis. 68. Small breathing is associated with A. Heart failure, B. Diabetic ketoacidosis, C. Bronchial asthma, D. Atelectasis. Correct answer B. Diabetic ketoacidosis. 69. Absorptive dressings are intended to A. Absorb nutrients for the wound, B. Remove drainage from the bed so C. Gather moisture from the atmosphere to keep the wound cool, D. Absorb blood from veins. Correct answer B. Remove drainage from the bed so 70. Which of the following medication orders are for every other day? A. QOD, B. QH, C. QD, D. BID. Correct answer A. QOD. 71. A patient is to receive 1000 milliliters of IV fluid in 6 hours. The drop factor is 15 drops. At approximately how many drops should the flow rate be set? A. 42 drops, B. 21 drops, C. 55 drops, D. 33 drops. Correct answer A. 42 drops. 72. In which of the following positions is the patient at greatest risk of shearing force? A. Semi-Fowler's position, B. Lying supine in bed, C. Trendelenburg position, D. High Fowler's position. Correct answer D. High fowler's position. 73. Movement of the joints away from the midline of the body is called A. Adduction. B. Adhesion. C. Adduction. D. Abduction. Correct answer D. Abduction. 74. What does the term chylosis mean? A. Cracking of lips. B. Bad breath. C. Inflammation of the gums. D. Inflammation of the tongue. Correct answer A. Cracking of lips. 75. Breathing that is normal in rate and depth is called A. Bradypnea. B. Tachypnea. C. Apnea. D. Eupnea. करेक्ट आंसर डी यूपनिया। कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना। एंड डोंट फॉरगेट टू सब्सक्राइब। थैंक्स फॉर वॉचिंग। सी यू इन नेक्स्ट वीडियोज।